Hi, everyone. Thank you so much for joining us today. My name is Dr. Dimple Patel, and I have our fellow board member, Tandra.
Hello, everyone.
We hope that you guys are doing well and got to enjoy the lovely weather we had today. It was nice to kind of go outside with a light jacket on. So we will get started. So we don't take up too much of your time this afternoon, but I wanted to start off by saying thank you so much for joining us today. On behalf of AFSP Illinois, the DEI committee is pleased to put on this program for you tonight, Unplugged with AFSP Illinois, an intimate conversation series. And today we'll be focusing on mental health in the Black community. Here at AFSP Illinois, we want to elevate voices, listen, and understand the experiences of the Black community. We're not going to get through everything tonight, but this is the beginning of many ongoing conversations that we need to have. And we hope that what we talk about today will continue to encourage others to want to know more about the experiences of the Black community as it relates to their mental health needs. Again, my name is Dr. Dimple Patel, and I serve on the board of directors for AFSP Illinois. I am currently working as a therapist in private practice in St. Charles and in Aurora, and I am the co-chair of the DEI committee along with Megan Shawn. I am looking forward to this conversation today, as this is something that I've been thinking about professionally, even as an individual. I wanted to engage in this conversation as a South Asian woman and a therapist. I remember what it was like when I was younger and being teased and made fun of and told, go back to where you came from. Those experiences stayed with me as I was growing up and really impacted me in my own identity as I was growing. And it also impacted my clinical work and identity as a therapist. And because of my experiences in clinical trainings, I placed a greater emphasis on wanting to learn more and continuing to grow as a clinician so I can serve and assist my clients in feeling comfortable or feeling accepted and having a safe space to be able to talk about these conversations, even if they feel uncomfortable or may not want to address some of these things. And so, but not everybody is like this. But this is the work that I've decided I wanted to do for my own personal growth. And for those of you that may not know, Tandra and I both joined the board at the same time, and we have had this mutual connection of just having very in-depth conversations and open and honest ones where we can both express how we feel. And from this, we wanted to include you guys in on our conversation so you get to see what we talk about. And if you have any questions, please feel free to type them in the chat below. Meg is monitoring, and feel free to ask any question that you would like. This is a safe space and we want to make sure you're comfortable as well. And so let me go ahead and introduce Tandra. She is the Director of Business Development at River Edge Hospital in Forest Park, Illinois. And she is a mental health therapist, an advocate, and a suicide prevention educator. And Tandra wears many, many, many hats and does a really, really great job of speaking up and also being there for others, as well as engaging in conversations that need to be had. And Tandra also serves on the board with me and is the co-chair of our education committee. So definitely reach out to her. Feel free to ask questions along the way and we will do our best to answer them. And so let's get started. So according to Columbia University, the Department of Psychiatry, research suggests that the Black community is 20% more likely to experience serious mental health problems, such as major depressive disorder or generalized anxiety disorder, and have a lower rate of seeking services for mental health conditions. So let's dive right in, Tandra. Can you talk a little bit about what we see within this disparity within the Black community?
Thank you, Dimple, for that introduction. I'm so excited to be here. And thank you to AFSP Illinois for the opportunity. And I love what you said, Dimple, about we're inviting people to our conversations because we have had some very open, honest, healing conversations. So thank you for making space for this and asking me to be a part of this. You asked the question about reasons for the disparity in the percentage of Black people who have mental health conditions and the lower utilization or lower numbers of Black people that seek out services. Well, there are many reasons for this, as you might imagine, and they're complex and related. One of the biggest issues that we're addressing and need to address within the Black community as well as in the larger community is this issue of stigma, stigma toward mental health. And we are all familiar with stigma. These negative attitudes, unfortunately, hinder people's willingness to reach out when they need help. And we're not going to, like you said, be able to talk about everything, but we really want to get the discussion moving. In the Black community, mental illness has been cloaked in shame and embarrassment, and the stigma in the Black community is real. It is one of the reasons why I decided to become a therapist. It is the reason why I advocate for mental health and suicide prevention, provide suicide prevention education, is because I realize within my community and within my family the stigma that's associated with mental illness. So as we have this discussion, I want to highlight just a few things that come to mind when we're talking about mental health issues in the Black community. And one that I come up against a lot, I see this a lot, is misconceptions about mental health, right? It's this idea of what is mental health. So you notice I'm saying mental health. So mental health is something that we all have, right? Mental health has to do with how we think and how we feel and how we behave. It's on a continuum. Our mental health is not good or bad. You know, our mental health is influenced by many different things, just like our physical health. And our mental health is important. It's very important. However, in our society, we see negative portrayals of people who are in crisis. We see how they are treated. And in the Black community, nobody wants the label, and excuse me for saying this, but of crazy, right? Nobody wants that label. And so that stigma is very, very real. And so I'm working and have worked to address the stigma. And I know that AFSP is committed as well to addressing the stigma. The other issue that I want to bring up that's very real, and I think we see evidence of it even now within the pandemic and the COVID vaccine, right, is the mistrust of the healthcare system. And I must say that as a Black woman who seeks care and goes to the doctor, that I have experienced discrimination. I've experienced times when I am trying to explain something and my concerns are dismissed or minimized. And that is historical. And we can have a whole conversation about that. But there is, right, part two. We're going to have many parts tonight. But the mistrust of the healthcare system is a very significant barrier. Lack of access to services and affordable services is also another barrier. I also want to highlight the fact that in many times in the Black community, the labels of, you know, depression and anxiety may not be something that many Blacks relate to or connect with. So we want to think about language and how we refer to symptoms, if you will. And so for many people, you know, talking about stress or feeling tired or exhausted can be ways that our loved ones are telling us that they're not okay. And so we have to pick up on other ways that Blacks might say that they're not okay. And so they may talk about feeling stressed or overwhelmed or exhausted. You know, they may complain about physical symptoms, you know, feeling tired and worn down. And this might be, for us who are friends and family members, this might be an indication that there might be something more going on. So mental health has to do with, you know, how we think and how we feel and how we behave. And it's not equivalent to mental illness, right? Mental health is not equivalent to mental illness or mental health conditions, right? Mental health conditions a mental health condition is a health condition, right? Is a health condition that negatively impacts a person's ability to think, their feelings, their behavior significantly enough that it impairs their ability to function. Absolutely. So there's a difference here, and I think that sometimes within the Black community, the misinformation and misunderstanding about what mental health is and what it is not contributes to, adds to the stigma.
Thank you so much for sharing that. And kind of to touch back a little bit on, you mentioned briefly about lack of trust in service providers or individuals seeking treatment. Can you share a little bit more about this and how can we address it in a therapeutic setting, in inpatient or outpatient settings?
That's a loaded question. So if we think about from a historical perspective, we see very real evidence, not, you know, in history, but also currently in the medical field and in our healthcare system, where they've been, you know, our institutions, the institutions that are there to help us, have been institutions that have actually oppressed and harmed us. And research really supports this. There's research that has been done that has shown differences in how physicians respond to symptoms of Black women versus white women. Reports of pain. I remember when I was giving birth, and for those of you who have given birth, you know, it can be very painful. And I was in pain, and the nurse pretty much patronized me and tried to minimize the experience of pain that I was experiencing. And so research has shown the bias and the disparities within our healthcare system, where my report of pain is received and treated differently than a white woman who's similarly in pain. And we see this also with Black children, right? We see that, you know, a Black boy, for example, who might be having some difficulties, maybe he's distracted, maybe he's a little irritable, you know, and maybe it's contributing to some behaviors, you know, some acting out behaviors in school. And then you have a white boy who is, you know, acting similarly. And what happens is the white boy or white girl gets referred to the counselor, to the social worker, and the Black boy or the Black girl gets a discipline referral. And so we see differences throughout in our institutions and especially in our healthcare system. And so I think that trust has been longstanding. And I'll be honest, you know, this whole COVID vaccine, just bringing it forward, you know, as informed as I am and as much research as I've done, you know, I have to say that the trauma and the experiences that I've had and that generational trauma, right? The things that, you know, my family members have shared, things that happened to not only my family, but for Blacks in America, impacted my willingness and readiness to get the vaccine.
And Kendra, I think also from like our own conversations, like we've had so many of just like, you touched on family and generational traumas or experiences that are passed on. You mentioned about like in our individual conversations about the conversations you have with your sons and how significant that's been, and that you have to have these discussions.
Yeah, I think this would be conversation number 3 that we're on. We're talking about trauma. And so not to oversimplify trauma, because trauma is very complex, But if I could just take a moment and just respond to your question, you and I have talked about this quite a bit. And so if you think about direct traumatic stress, right, those are things and events that may happen directly to me, right? That's direct traumatic stress. And then you think about indirect traumatic stress. This may be things that I witness, right? And so when I think of indirect traumatic stress, I think about the murder of, I was getting ready to say his name, and then every Black person that I could think of came to mind. So, right? So that trauma and seeing the videos and seeing people who look like my brothers and my father, my husband, my son, seeing those videos, that's indirect traumatic stress. And seeing those images affect my mental health and well-being, how I feel, the conversations that I have with my children. And then thirdly, I think when I talked about transmitted, traumatic stress. And these are things that are handed down from generation to generation. As a mother of Black boys, I have to have conversations with my children about things that other people don't have to have. And, it is just something that we do. And so my heart's heavy for my children, and the conversations that we have to have on a very regular basis about the world and how they're experiencing the world, the things that they've experienced. My children are 15 and 10, and my 15-year-old has had several experiences of racism directed at him and discrimination. My youngest son is 10. He's had those experiences as well. We know, and research has shown, that experiences of racism and discrimination, as well as feelings of hopelessness, are risk factors for Blacks. So we have to really understand the impact of these experiences on the mental health and well-being of Black people.
And definitely, I think you also kind of touched on that part of that racial justice and how violence impacts individuals across the age span, from younger kids to adults, families, grandparents. How, with the current environment and just everything going on, how have you as a person, but even as a mother, coped with all of this? Or how do you cope?
Oh my goodness, she getting deep, y'all.
No,
and Dimple knows that I'm very comfortable with sharing. I will say the past year has been very, very difficult. I have experienced grief. I've experienced loss. I've been angry. I've been sad. I've had moments where I didn't want to get out of bed, and I just want to pull the covers over my head and just go to sleep and wake up and everything is gone and done with. And, there are roses and rainbows, right? So I will say that my mental health has been affected and impacted. And, I've had to rely on support of family and friends to identify times when I just wasn't okay. And being okay with not being okay. When throughout this past year, a lot of us were checking on each other. It was one of the rainbows, I think, and the gifts of the pandemic, is I found that not even just my close friends, but, people that I work with, certainly my AFSP family, everybody was just really a lot more thoughtful and saying things like, hey, how you doing? And really want to listen. I mean, before the pandemic, we would say, hey, how you doing? And we really didn't want to hear it. But I really felt like people were really interested in wanting to just check in with people. And so over this past year, I've had to make sure that I'm checking on myself I'm checking on the folks in my family. I'm checking on my friends, because one of the things that we know, especially as a Black woman, you know, I'm not super all the time. You know, I can't hold the whole world together. I don't have all the answers, you know, and sometimes I need an outlet. And so I'm thankful for having those outlets in, you know, friends and family members, and as well as my faith too. I have a very strong faith, and that's also something that is a protective factor for many people in the Black community, and people in general, but we're having a conversation about mental health in the Black community, is faith. And faith for many people gives hope, and we know that hope, oh, look, I didn't even plan that.
Oh,
Hope is a protective factor. I really didn't plan that. I really did not plan that, seriously. So
I think, hey, it's a great way. Maybe next time I should wear my shirt, maybe, if I can find it. They're in the wash right now. But I think that was a really great point to share, of like checking in with each other, but also checking in on ourselves. I like, that's a big thing I think we were forced to kind of look at when things started slowing down with everything, and just kind of being mindful. But on the flip side of that, with especially with teenagers and kids and everybody, that isolation piece of things, what would you say about that?
repeat the question. I didn't hear the end
Sorry.
part. I'm
No,
sorry,
that's
Dimple.
okay. I was talking on the flip side of it, just like especially with teenagers. A lot of the work that I'm dealing with right now in the clinical setting, I'm working with teens who are struggling. They're just isolating, and COVID is really impacting their emotional and physical well-being, as well as social interactions. And can you touch a little bit more on how that is impacting, or how you believe that's kind of impacting our youth, and also in particular to suicide as well?
So there's a saying, when white America gets a cold, Black America gets the flu. I'm gonna pause and let everybody kind of digest that. And we know, because we hear it every day, we hear the impact that the pandemic is having on the Black community, and the disproportionate impact that it's having. And when we think about young people, you know, who are, many of them are physically isolated from their peers and from family members, we know that the impact is real and it's heavy. And I think that one of the things, if I could use myself as an example, one of the things that is important is, and we mentioned it before, is the importance of connections, and making connections, and being creative and finding ways to make connections with people, even when we're in the pandemic. I always say we must physically distance from one another for safety, but we don't have to be socially distant. And I know that everybody is zoomed out, right? Like another video call. But I've seen a lot of creativity. My church youth group has done some very creative things with our youth, with our teenagers, to let them know that we care about them, to connect. And so I think it's really important for us to prioritize connections, and we can still connect even though we're being physically distant. So you asked me about suicide. One of the things that I want everybody, and I know we at AFSP, I know we are very thoughtful about how we talk about the impact that the pandemic is having on suicide, because we want to be responsible in helping people understand that we really won't know the full impact that the pandemic is having for several years. With that being said, we do know that we've seen some increases in suicide rates, particularly among Black youth. And that's something that has come to the attention, the Illinois Department of Public Health, as well as national attention. And so we have to be thoughtful about some of the things that impact those rates and what we need to do to make sure that we are reaching all of our young people, but especially our Black youth as well, to begin to address. And I think that the pandemic is revealing a lot of the disparities that have already existed within the suicide prevention field.
Mm-hmm.
Can I say that, right? So I think that those are some of the things that we need to do. And I know that AFSP is being very thoughtful and mindful about our messaging and our programs and our reach, because our goal is to save lives and give people hope. And so we're committed to doing that.
I actually have a question from one of our attendees. They had asked, how can you get Black men to become more comfortable with the topic of their mental health? And do you see this significant with men more than women?
Can you repeat the end of the question?
Do you feel that this is more prevalent with men? Or could it go both ways?
So I think that one of the ways that we get more Black men comfortable talking about mental health is to have more Black men talking about mental health, right? Representation matters.
Yeah.
People have to see people like them. We also have to know where to go to talk to Black men, right? How do we reach Black men? Where are they? Are they in the barbershops? Right? Are they in the churches? Like, we have to know where they gather and where to connect with them. But we definitely have to have more Black men. And there are Black men sharing their stories. There are Black women sharing their stories. And, we see celebrities doing it, right? But we also see everyday people doing it. So I think one of the things that we need to do is make sure that we elevate the voices of Black men who can reach other Black men and Black women as well. I'll tell you, as a Black woman, there's certain things that I'm taught, and there's certain ways I'm taught to be, and I'm taught to be strong, and I'm taught to hold the world together. And I'm taught you ain't got time for all that other stuff. You got work to do, right? You got to take care of your family, and those expectations, and not even to mention the impact of racism and discrimination that's evident and exists in our institutions. All of that just weighs heavy. And so I always model for my friends who are Black women, that you don't have to be super all the time. No one expects you to be. And it's okay not to be okay. But we have to have Black men doing that so that other Black men can connect with them. We have to have Black women do that so that other Black women can feel a connection. I think that those are one of the first steps that we need to take.
Thank you so much I do agree that seeing someone that looks like you, that understands your experience, is really significant. And that was one of the main reasons that I chose also to get in the field of psychology, where I felt that my community wasn't represented as well, and my thoughts and beliefs, that I didn't connect with somebody that wasn't a South Asian therapist. And I wanted to get back and give so that others could relate and understand that it's okay, and we need more of us out there to represent the community. And it's nice because sometimes I don't have to explain certain words or certain meanings. And it is great because I can just go straight in and just talk about whatever I want to, and she gets it.
That right there, what you said, that is so true. I became a therapist for the very same reason, although I do not actively provide therapy. But if you think about it, and I'm going to try to remember this, and forgive me if my statistics are off, But I think that there are 4% of social workers
Mm-hmm.
are Black,
Mm-hmm.
and I think 2% of psychiatrists are Black
Mm-hmm.
in this country. And so think about that. And exactly what you said, it has to, excuse me, it has to do with a level of comfort, right? It has to do with a level of comfort. Having a shared racial experience is important, but I don't want folks to think that it doesn't necessarily guarantee, that you can relate, because still a relationship with a therapist is individual. But what you said, Dimple, is that there's some certain unspoken assumptions,
Mm-hmm.
right, that are evident. Imagine me sitting with someone, sitting with a white therapist, and I'm explaining my experiences of racism or discrimination. I'm not certain if that individual could understand and be able to appropriately support and respond and help me process those experiences. Because I've often been told, and not by therapists, but just by people, that, oh, was it really racial? Were you overreacting? Are you kidding me? Don't get me started. So having a clinician that is culturally competent is important. It's important to have a therapist that understands the role of culture and can support Black people who do choose to seek treatment. And fortunately, there are more resources than ever now. I'm not going to say that there are enough, but we have some resources. I know that on AFSP's website, I don't know if we've been able to put that in the chat, but we have some good resources.
Yeah, you have to put it out. I will get that. Sorry, go ahead.
So some resources, and look, it's not exhaustive. It's not an exhaustive list, but it definitely is a start. I know in the past year, I myself have helped people find therapists, and I go to, therapy for Black girls, and I share that, and I send those links to people who are looking for someone who looks like them. And I think that that's important. We have to do a better job of making sure that people are comfortable and we increase representation of clinicians of color.
So that leads me to my next question, and this is something that we had also talked about too. You had mentioned something about the savior complex. Can you talk to us a little bit more about that?
Dimple pulling all the private talks,
I know.
all the private conversations. No, it's good. So I did talk to you about the savior complex or the hero complex. It's called different things. And it was really comes from my experience and my training as a clinician. And as I was going through school and working in the mental health field, I encountered people, non-Black individuals, typically white people, who saw themselves as the rescuers, rescuers for, they would say, inner city, marginalized people. And I found that because of racism and privilege, that they often felt like they knew what was best for people. And so that was something that I saw up close and personal and experienced, not just in my training, but as a professional when I was, working as a therapist. And so if there are any therapists here, any clinicians, you need to check your hero complex. And you need to really look at yourself. The work starts internally. And no one wants to be rescued.
I have a question.
So that's the savior complex.
Oh, yes. Thank you so much for sharing that. Because I know that that's a topic that doesn't get addressed a lot, that we might see it even in our clinical trainings. I've been very fortunate that my supervisors, really do focus on diversity and also being mindful and aware of our own interactions or any potential biases that may come that maybe we don't notice it, but it could come off by our verbal, nonverbal communication or body language. But we have another question about how do you?
Can I share something? I just thought of something when you said that, and then we'll get to that next question if that's okay.
Yeah.
I want to share this experience that occurred. So there was a family, a Black family, a mom who reached out to me about her daughter and wanting some help. And I talked to her and, convinced her. She was hesitant, and we can talk about this. Some really concerning behaviors. Her and her daughter had got into kind of a physical altercation, and her daughter had a history of mental health problems, and the mom did too. And they got into a heated exchange. And so, of course, I was concerned about safety, issues of safety. And when those are issues of safety, what do we tell people? We say, call 911. And what I know is that for many Black people, calling 911 is not often seen as help.
Mm-mm.
And we have to think about that, right? And so me and Mom had a conversation, and she said, I'm not calling the police. I knew she wasn't going to call the police. And she said, I'm not calling police because I don't want them to take my daughter away.
Mm.
Now, I don't know the situation. I don't want her to take that was her experience, and that's what she's seen, And so I convinced her to go into treatment, or to go to an appointment. She went to the appointment, and she called me after the appointment, and she said to me, I didn't feel comfortable. And I said, well, I immediately went into mama bear mode. I was like, oh my gosh, what happened? She was like, I just didn't feel comfortable. It wasn't a warm environment. And I said, well, did they do or say anything? And she said, no, it was just, I didn't feel welcome. Now think about that for a minute, right? That is not, she didn't say that someone said anything, but she felt a certain way. And as a Black woman, I know that feeling. I know when a provider walks into the room, based, how they interact with me, I can pretty much tell what that experience is going to be like. So this mom, had an experience where she just didn't feel comfortable. And it was nothing that anyone said or did, but as providers, we have to be thoughtful about the environment that we create, and that the environment and the people, the staff, understand how to make all people feel welcome.
Absolutely.
So you had a question. Someone had a question.
I did.
Mm-hmm.
Again, thank you so much, Tandra, for sharing everything that you are. The question that we have is, how do you address intergenerational trauma that hasn't been addressed yet through a Black family beyond dialogue?
You pray. No. That is a big challenge, right? It is a big challenge. And oftentimes, I don't know if this is an individual asking about their, a family member, or if this is someone who is a clinician. So I'll try to answer both ways. In families, it is something that's very hard to address, right? Because it's trauma that has been passed down generationally, and it's other traumas that keep happening, and trauma on top of trauma, and then you have very complex trauma. And so if you're a part of a family where you're seeing some of these patterns, you know, I would recommend that you decide to seek some support for yourself, to help understand the impact of the trauma on you if you're part of a family system. And sometimes by you prioritizing your well-being and mental health, you begin to learn strategies to how to cope and how the trauma has affected you. And sometimes your family members and your loved ones are able to see that. If not, then you can become an advocate within your own family, providing resources, right, for people, recognizing destructive patterns and offering those resources to family members who might be struggling. So it's important for us to take care of ourselves individually, and sometimes it just takes that one person in a family to begin to address some of the things that are generational.
You know,
if you're
go ahead.
Go ahead, Dimple. I was going to say, if you're someone who's working with a family and you see these types of issues, you know, building trust is so very, very important. And this may be part 4. I can share a few things about some of the diverse families that I have worked with as a therapist, and the things that I had to do to gain their trust, you know, in order to begin to work with them, right? And so if you are, you know, a clinician working with a family where you're dealing with this, it's important to make sure that you have established trust. And then also identifying other support people, right? Support people in the community. Maybe it's a pastor. Maybe it's an auntie who's not really a blood relative, right? Maybe it's an extended family. Maybe it's a godmother. In many families, there are other people that, in many Black families, there are other people that individuals trust that you can work with to try to support and address the issues with the family. I know that was kind of very broad, but I tried to do my best to answer.
No, thank you. A participant also kind of touching on that, it kind of brings up what one of our lovely participants had kind of stated, that from, and I quote, "We need not to reinforce our own stereotypes and internalize oppression that was shut down Black men and women when trying to be authentic with their struggles," unquote.
I think that is very important. Yes, I think that's very important. We have to be very thoughtful of not reinforcing stereotypes and not re-traumatizing. And I think that a lot of people, because they're not comfortable with their own identity, and you know, they don't understand their own role in the racism that, you know, is inherent in everything that we do. You know, you say things like white privilege, and some people, you know, run with it and are cool with it and understand what that means, and other people are offended and, you know, they stop listening, you know. But we have to begin to have these conversations about these issues in a way where people feel safe and feel safe to ask questions. And not that I have all the answers, right? But things that I don't know, I do know people I can ask. But we do need to have these conversations. They're very important.
You know, I think when you touched on that, like the privileges that we have, even as a South Asian person and a therapist too, you see my last name, Dr. Patel. Like, there's automatically certain stereotypes that come with it, and then I have to be like, no, not an MD. So, and like all these things that I'm like, but that like the assumptions that are tied with it, and certain beliefs that are kind of tied within our identity, and it's lot of work that we need to do on that and continue to work.
Yeah.
And that's the other part of reflecting in. Yes, I have the privilege of, you know, when I say Dr. Patel, that there's a different way that I'm either looked at or taken or even interacted with, but then there's the other side where I don't look above 30. And then it's like, are you even old enough to work with me? I am. So there's all these like different parts within it too, but also like realizing what are my own privileges, being an Asian American, but also even as a doctoral level clinician, and how does that apply? But how does that apply within the clinical setting or even in the families that I work with? And a lot of times, even with if it's kids and teenagers, I really try to bring in the family while still respecting confidentiality and work on building that independence and that identity work, especially with teenagers. There's a lot of that identity versus role confusion stage, and really working on who they are as a person, but also especially even in the South Asian culture too, where we talk about needs of the family are kind of put first versus individual needs. And often in the work that I've seen, that we're really trying to figure out who people are, even when they're teenagers, kind of developing their own identity.
And you touched on quite a few things. You know, we have multiple identities, right? And our identity development and how we refer to each other and how we see each other, it evolves and it changes over time. And, you know, you mentioned, you know, several identities that you possess. I have, you know, different identities in the way that I see myself. And so I think that from a clinical standpoint for therapists or individuals who are working with, you know, people in the Black community, you got to do your own work. You have to do your own work first. And that work is around cultural humility. Don't ever think that you know another culture. Don't ever assume that. Your job is to lean in and listen and learn. Right? That's your job as a therapist. And so asking people, you know, you mentioned about family, asking people, you know, who's in your family? You know, how do you define family? Right? It's so very important. Asking people how they identify themselves. Being open, you know, and asking those kinds of questions, because you're going to get so much when you listen, you know, to other people and you hear their experiences. And if you don't understand something, don't be curious and ask and say, help me to understand what you're saying or what you're going through. That means a lot. And a lot of our conversations, Dimple, have been just that. You know, you've been like, well, I don't know what that's like. And then you listen and you say, wow, Tandra, right? And, you know, you don't try to fix it. You don't make it better. You just listen. And that means a whole lot.
Part of my job, but also part as your friend too. Listen to that. And you know, we touched on a lot of good stuff right now. But this kind of leads me to a conversation I had with a colleague of mine where she recently shared an example of a client providing her feedback on her intake form that the client felt validated and represented. And in the intake form of how does she identify? Does she identify as Black, African American? And she also included Afro-Caribbean. And this was the first time that she felt represented, that there was a box for her, or not even a box, but there was where she could be in and like, oh yes, that is me in there. And kind of talking a little bit more about, you know, that intersectionality that we kind of talk about in our own conversations. And you know, my favorite question, I even ask my clients this all the time, and they always like, I have no idea. But my favorite, like the questions that I ask is gonna be one I'm gonna ask you, Tandra. And I'm gonna ask
everybody. I feel like I'm sitting in her chair in her office. No, I'm just playing, Dimple. I'm just playing. No, I don't.
Tandra, how do you personally identify? Because we talked about other
I
people, but how do you identify?
how do I identify? I identify as Black. I am a Black American. That is a choice that I've made for myself. And I do so because for me, I want to show solidarity in the collective experience of Black people around the world. So there are Black people that live in other countries, right? And so for me, my preference is to be referred to as Black. That's how I identify. There are people who identify as African American. That's nation specific. That's specific to experiences here. Now, I was born here and I was raised here. I have not lived anywhere else. So I've had similar experiences to, you know, the enslaved Africans, right, that were here, brought into this country. So, but for me, as my personal identity, I identify as Black. Someone who identifies as African American, that's their, you know, that's their personal choice. And at one point in my life, I did. You know, I did. And so that's when I talk about how we see ourselves can grow and change over our lifetime.
Thank you. If we were in a session with me, we'd be going a lot more in depth, but another time.
This is not your session, and no, you can't bill me.
Oh, I guess
you're not on my insurance. You're not on my insurance, Dimple.
One of the other, we touched a lot, and unfortunately, you guys, we only have about like 6 minutes or so left, but maybe we'll go a little over. Who knows?
Have we answered questions?
Yeah, I've been answering questions
okay.
along
Perfect.
the way. And this is the one that we've had, so I wanted to kind of touch on this as well. What are your thoughts, Tandra, on integrating curriculum for African American youth from grades K through 12, and how can this either be modeled within academia or even teachers? Where do we start?
You're asking me that question. Are we talking about mental health curriculum?
Yeah, I believe so, on mental health curriculum, but also like having kids be taught and modeled that mental health is okay, and that how to learning how to get the support that they need, and feeling comfortable to say, I feel blank.
You know, I'm really excited about the integration of they call it SEL, social emotional learning, right, into the curriculum. And I know that in most school districts they've, you know, adopted a curriculum that really helps children at a very young age understand feelings and emotions and coping skills. And so I do think that curriculum should be a part of, you know, the educational curriculum, and shouldn't just be something that's like, hey, once a week, right? It should be something that's fully integrated into education, because we need to help young people learn how to deal with, remember, mental health is how we think and how we feel and how we behave. And so we have a responsibility to teach children how to do that. And that curriculum, you know, should grow and be developmentally appropriate, culturally appropriate, linguistically appropriate, all of the appropriate, right? It really needs to be meeting the needs of the students. Additionally, you also, I think we have a responsibility to also educate families and caregivers,
yes,
right? And provide opportunities, excuse me, provide opportunities, provide opportunities for, parents, family members, and caregivers to also understand mental health and to learn strategies. I know I sound really bad. I sound much worse than I feel. I got something in my throat. But I think also the curriculum should provide a parent training component is what I'm saying.
And that was actually going to be a follow-up question for me that I wanted to ask you. How can youth and kids kind of, or parents, vice versa, like how can they address bringing up wanting to go see a therapist from parents' perspective or from like a youth perspective, having that conversation within the family?
You know, I think we all have a responsibility to be smart about mental health. And that's one of the things we want to do. We want to create a culture that's smart about mental health. We want to have these conversations as a regular part of our interactions with our family members and loved ones. And I think that if we continue to do that, you know, the work of AFSP, the things that we're doing here in Illinois and across the country, having these conversations to destigmatize mental health. And then I think that as we continue to do that, you know, going to see a therapist or talking to a counselor will be just as easy as, hey, I got a stomach ache. All right, you know, or I'm not seeing the words on the screen and I need to go to the eye doctor, or I have a toothache. That's what I want. That's like my wish, that we take the stigma away from it, and, you know, we're able to have the conversation and recognize when we're not okay. And I think that parents have to take a lot of that responsibility. Adults have to take a lot of that responsibility, because our children and young people are watching us. They're watching how we handle things. Right. You know, and so we can be role models with that. And we have to talk about the issues of stigma, and we have to destigmatize it. We have to say, you know what, it's okay not to be okay. And I do that all the time. I'll be like, you know, some days I'm just not feeling it. I'm just not okay. And I'm gonna go take a nap, or I'm gonna take some time out, or I'm gonna talk to someone, you know, about it, someone professionally, or I'm gonna call Dimple and see if she can give me a single case agreement on my insurance, or maybe she'll see me at a discount. But we really just need to be smart about mental health and address the stigma in the Black community. And what's hopeful about the times that we are in is that those conversations are being had. Yes. And we see, you know, I think I saw a statistic that 8 out of 10 Black Americans you know, attend church, right? And I know that we're physically distancing right now, but, you know, utilizing some of the natural supports within the Black community, like the faith community, right? To provide education and to connect with, you know, the community, because faith and religion is a protective factor. Right? We're talking about risk and protective factors. So in the Black community, we want to build protective factors and we want to reduce risk factors. So we want to address things like, you know, things we've been talking about, racism and discrimination and stigma and all those things that really wear on our mental health and well-being. And we want to promote protective factors. We want to increase those protective factors. So we want to strengthen connections, informal and formal supports. We want to make sure that there's access to health care, right? We know that when people get treatment for their mental health condition, you know, that reduces their risk for their condition worsening, or for them even having suicidal thoughts. And, you know, religion and spirituality is also a very strong protective factor. So we want to build protective factors, and a lot of churches are doing that. They're seeing the importance of the role of spirituality and mental health support. So that's a very positive thing.
So I have 2 more questions and then we'll end. But Tamara,
okay,
can you do me a favor? Some participants have been asking, how can they reach you? If you want to type that in the chat, either any of your social media platforms that they can reach you at, or anything where if they want to talk to you a little bit more.
Okay, I will put my contact information in the chat. And the second question is?
Okay, I have one more after that too, and then we'll end.
Okay.
But so kind of speaking from, you know, I'm a clinical perspective as well, but what about how can teachers or other adults in the school system, but even let's say they're like talk to a student or even like a younger kid or teenager of seeking support, or how can one approach somebody without like, hey, you this and this is going on, maybe you should go see somebody. What is an appropriate way? Because I think that's what I've heard from other therapists, that I don't know how to approach kids or other individuals where we're like, how do I say it? What do I do without either sounding wrong or might not hit the point? How can we as a clinical field approach that?
So I have to focus on this question because this is a very important question. So right now I can't multitask and put my contact information in the chat. So I'll get back to that. And we can maybe follow up with an email too to the participants, you know, in ways that they can connect with me, because I want to make sure that I, you know, respond to this. So it's interesting when you talk about, you know, how can therapists and clinically trained people, you know, kind of talk about these issues. And one of the things that we know that even within the mental health field, that there are many people, many therapists who are uncomfortable, you know, with asking anybody, let alone children and adolescents, if they are having thoughts of suicide, for example. And so what I say to people very simply is, you know, ask someone if they're okay, if they are having, you know, whatever it is that you're observing. Be very specific, you know, say something like, hey, I noticed that, you know, you've been angry and, you know, or you've been irritable and you said this and I'm concerned about you. Or, you know, be very specific and don't be afraid to ask. And if you think someone is having thoughts of suicide, then don't be afraid to ask the question. I'd rather you be wrong. I mean, you'd rather you be wrong, right? Be wrong than not to ask the question, right? Yeah. And there have been times when I've said, you know, I don't know, you know, what's going on exactly with you, but are you having thoughts that you might want to die? Are you having thoughts of suicide? You know, I care about you, and that's why I'm asking, you know. And for people who are struggling, that can be a relief, because what we know, don't get into a Talk Saves Lives presentation, but what we know is that individuals who are contemplating suicide, that they're often ambivalent, you know. There's a part of them that really is struggling with the pain and really don't know how to get relief. And then there's a part of them that doesn't want to die. And so they're in this kind of state of distress. And many times they're waiting for somebody to say, hey, are you okay? Mm-hmm. Right? So ask the question. Don't be afraid to ask the question. Ask it non-judgmentally. So you wouldn't say like, you're not thinking about this, are you? Because that would just be crazy. No, don't do that, right? But ask the question with compassion and concern, being curious, sharing your concern for their well-being. If they say that they are struggling, you need to know what to do. Next steps. You need to contact their parents, or if it's an emergency, you know, calling 911, reaching out and have a plan. You don't have to have all the answers, and you don't have to feel like you have to fix them or solve their problems. That's not your job. You know, ask them the question, give them support, do it non-judgmentally, and connect them with resources. I think, does that answer the question? Yeah, it's a very important question. And I'll say a shameless plug. This is a shameless plug. Yeah. But I mentioned AFSP's programs, Talk Saves Lives. We go over this gatekeeper training, and we actually have several have been planned this month and next month. I'm doing one on Saturday morning. Not that you have to come to the one I'm doing, but I'm just saying that's the one I remember. I can't remember the exact time, but we have several of them planned over the next month or so. And we also can come to you, you know, if you are ever interested in providing the gatekeeper training to your group, whether it's your church or, you know, your workplace, please reach out to us. We do the trainings at no charge. And we get into a little bit more detail about suicide, risk factors, protective factors, and what we all can do to reach out. And I can't overemphasize the importance of connecting with people, reaching out when someone is struggling and asking them, you know, if they're okay.
Oh, yeah. And I think just to quickly touch on that too, Tandra, I've also gotten very creative in the sense of like approaching suicide too, because when you ask, are you going to kill yourself or are you suicidal? There's also that stigma associated with the word suicide, and getting creative with, do you ever feel like things are so hard that you don't want to get up in the morning? Or do you feel that it's just so, like you're struggling so much that you just don't see a way out? And so
you feel like you want to give up. Yeah.
Mm-hmm. And so, but I also like see where like my clients are prior to asking directly. If I have to, yes, I definitely will. But it's also like understanding the cultural background too, and how mental health is viewed. And I kind of use that relationship as a guide to address how I'm going to ask risk-related questions.
And remember when I talked about, with, Black folk, that you might say something, you might ask about stress, or you're listening for them talking about stress or being exhausted or tired, or you're listening or you're looking for physical symptoms. They may not say, come out and say it, well, I'm depressed, or I have anxiety, but you're listening for other things. You're listening for things that indicate that someone is just not okay. So I do want to say that someone, and I should have gotten a lesson from Dimple. She is the queen of social media. But someone said that they wanted to connect with me on LinkedIn. I can't remember my LinkedIn, but but my email, I did put my email address in there for anyone who wants to connect directly with me. I would love to do so. If you have any questions, for me directly.
And our very, very last question, I'm sure we can continue. We can do like multiple parts on this. But
I think we're on part 4 or 5.
I lost count. But my last question is, what can even AFSP National, even our chapter, other organizations, communities, what can we do to continue on with this work, or what should we be doing to support?
Yeah. Well, I think what we're doing now, right? We're creating space to have conversations. And I know that as an organization, and many organizations are doing it, in the wake of everything that's happened this year. But I will say that AFSP has been committed to understanding individuals and their experiences, and making sure that people have resources and access to resources that they need. So I think that we have to, and I say we collectively, right? We have to demand better, right? We have to demand more. We have to our institutions accountable. As we're listening and we're learning from one another, what are we going to do with this information? Like what are some next steps, right? What are you going to do as an individual? We're all connected to organizations, institutions, and families. So what are we going to do? So the challenge is individual, right? And the challenge is collective and institutional. So we can't sit and wait for other people to pave a way for us. We are going to have to say, we need this. And, this conversation came about because of that. You know, this wasn't part of a strategic plan, or we're trying to, you know, we having conversations and being moved to create this platform and the subsequent conversations that we're going to have. So we all each have a responsibility and a role to play.
Oh yeah, we kind of talked about this back in like December, and so
yeah.
So we're always having ongoing conversations, but on behalf of AFSP Illinois and Tandra and myself and the DEI committee, we want to say thank you so much for spending your evening with us. I hope you were able to take away a ton of information, and please feel free to reach out to either one of us. If you're in need of services or wanting to get connected, we can help you find those resources. And if you are in search of a therapist, one of the easier ways to go is psychologytoday.com, and you can filter by faith, clinician, ethnicity, and race. So it does cater to the and insurance type, or if they're accepting other forms, sliding scales. So it's also important that that resource is also available. And we have definitely included our website, and Courtney sent a link with upcoming events. So please feel free to sign up for our newsletter so you can get all this information. And also on March 6th, if you're looking for a way to get involved, we have our annual volunteer gathering. And if you do want that link, please do email us and we'll send it to you. Thank you so much for joining us, and we will have more conversations. So thank you.
Thank you.